know that women have fears and their partners, and some of those fears are very valid, but many of them are not necessarily going to happen. So what I do with my class is I ask them to write down their main fear, and I've managed to put that together over the years. And so I'd like to share with you 10 of the fears that come up quite often, and I'm thinking or hoping that perhaps I could help if you have any fears that I mention, that it would be helpful to listen to this. So the number one fear that comes up is that you're going to tear during labor. And tearing is a very valid fear because of the fact that many women do. But I would like to, just on a positive note, give you some things that you can do to help prevent tearing. The first thing is arm yourself with knowledge. Ask your care provider what their episiotomy rate is. Find out if they are supportive of natural birth. And the research shows that hands-off during the pushing phase is much more effective than forcing a woman to push. So get to know your body, read your body well. When it comes to labor, it's better to be able to feel when it comes to pushing as opposed to being numb. So first of all, not having an epidural would decrease your risk of tearing, because with an epidural, you may not be able to feel to push, and because that is a process that takes place and the tissues stretch so beautifully, if you need assistance, very often with an epidural, there's a slightly higher increase of forceps or vacuum. And when the baby needs assistance to come out, you may need to have an episiotomy, which is a cut really on that perineal area between the vagina and the anus. And that cut is made in emergencies or when there's an assisted birth to help get the baby out quicker. It very rarely should be a routine. So you need to find out from your care provider if it is done routinely, and if it is, it would be best to discuss not having the episiotomy. There are situations where if it appears that the mom's going to have a severe tear, that the episiotomy may be safer to do. Another concern around tears is that it would take a long time to heal. And will they be able to have relationships later? What will their sex life be like? Are they going to be incontinent? There's a lot of misconceptions around tearing and those future health concerns. Usually with first-time moms, anything from 50 to 60% of first-time moms can have a tear, and that would differ in its degree. So you get first-degree tears that might just involve a bit of skin, second degree a bit deeper, third degree, and in that case, it may be better if it looks like you're heading for a third-degree tear for the doctor to do an episiotomy. So really in rare cases. To prevent a tear, we know that women who do perineal massage, starting at 32, 34 weeks, a couple of times a day, could actually help to prevent tearing. Some devices are on the market at the moment, such as the Enemas, that would help you to stretch your muscles and get familiar with that sensation of when the head is right there, of how to use your muscles. It would help to stretch, and that would also be beneficial. Many of the studies around these devices are actually done by the companies, so they do show an extremely positive outcome, but it cannot possibly be harmful to do perineal massage if you so wish. Another thing that is very helpful is that your care provider does not force you to push when you're not ready. When it comes to the pushing phase of labor, it really should be that when you have that sensation to push, that you go with your body and you push, as opposed to being shouted at or told, push now. So anyone who's doing that can also impact the tears happening. Another way to decrease tears would be a midwife delivery. So most midwife deliveries tend to automatically be no episiotomies routinely, respecting the fact that the labor can be a certain length of time, and that's okay. It doesn't have to be according to the book. respecting that when it comes to the pushing phase, you may want to change positions from lying flat on your back, which is in fact not a helpful position, to going on all fours or perhaps squatting, which will help everything to open up so much better. So having a midwife would decrease your risk, and certainly having a doula. A doula is an amazing support person who will help you to get into positions that would assist you with the pushing phase. They would help to relax you, and of course being relaxed is very, very important for a good labour. Water births. Women who opt for water birth, their tissues tend to stretch better and less incidence of tears. So in summary, the outcome in terms of decreasing tears, it would be really, really important that you consider a midwife, take a doula with, think about water birth, do your perineal massage, consider the device just to help, and make sure you've had the conversation with your care provider. Very few women tear badly, and when you do tear, you are sutured so beautifully afterwards that you will heal. It's very rare for women not to heal. Firstly, it's important that when she goes to the loo, she's not afraid to go. So often the moms, when they've just had their baby and just arrived back in the ward, or if they've had a home birth and go to the bathroom, they're very worried that it's going to burn. And sometimes it does slightly. So I ask all my moms to keep a spray bottle in the bathroom of cold water, and make sure it's a clean spray bottle that they've bought for this purpose. And they spray either while they're weeing or afterwards to decrease the acidity of the urine. And it does help hugely afterwards when they're finished, if they just pat dry and not rub that delicate area and really treat it like a wound. Definitely important that they have an ice pack post-birth. So we're talking specifically about natural birth here and tears. In the labour ward of most hospitals, they will have perineal ice cold packs. It's a pack that you twist, and ice cold water is activated within. It looks like a pad, and they put that directly onto the stitches or their perineal area, and underneath their pad and then their panties. So you want to decrease the swelling. The pain after having a baby, especially if there's stitches, is from the swelling. And this cool ice pack would help. And if you have hemorrhoids, it would also help significantly with that. You can get those ice packs at most good pharmacies and in hospital. And then cleaning of the wound. You should have a couple of sitz baths a day. It is hard to fit in, but 3 to 4 a day would be ideal. And you can use salt in the bath, just a handful, or of course salt, or you can purchase lavender drops and put that into milk, which is the carrier, a mug of milk, a couple of drops of lavender. Make sure it's the drops that are intended for the bath and not your Bunsen oil lavender drops. Put that into the bath, and that would help a lot with healing. And the aroma is beautiful, and that's also a very good idea. We don't want moms to worry about sex post-birth. Many of them, they are, and that's understandable. I always let the moms know, wait till you're ready, and very often the 6-week checkup doesn't necessarily give you the go-ahead, but would tell if the bruising and swelling and healing is taking place. And if the stitches are usually absorbable, so the sutures should have disappeared as well. And then it's between you and your partner when you feel comfortable. Most women do have dryness, and that's related to the hormonal shift. So KY jelly or a good lubricant would definitely help. And we recommend that couples who are struggling with this get help sooner rather than later. So if it's 6 weeks or after the checkup, you're not really feeling up to it, it's important that you talk about it with someone, and there may be help available so that you can continue. Following a natural birth, you may feel a little bit scared when it comes time to go to the toilet. Most women post-natural birth don't want to say anything, but they fear that first poo because sometimes the stitches are very close, they're a little bit swollen, and it's tender down below. But when they go to the loo, they hold back. That is the worst thing you can do. You need to go to the toilet when you get that urge. Take your spray bottle, spray, perhaps sit in the bath, run yourself a nice bath, and as soon as you've been to the loo, instead of wiping the area, you can always just step into the bath. That way it will help things to heal beautifully. You want to keep the area clean, and you absolutely don't want to be straining when you go to the toilet, because having a poo when you're constipated and you've had a natural birth can cause the stitches to tear. It can also cause a lot of discomfort and have you coming back into hospital will not be a good idea. So we want to prevent that. If you get the urge to go to the loo, please go. If you can ask your doctor to write up a stool softener in case you are a bit worried or a bit tender down below, please do that. If you're suffering from hemorrhoids, they may be quite painful post-birth because of all the pushing. You would then need to ask for a cream that can just localize that area and help with the inflammation. If you've had a Caesar, it's surgery that's very close to the bowel. When you're given the spinal anesthetic, in order for them to do the surgery, your peristaltic movement of the bowel is now paralyzed. So instead of the bowel moving the food down, it sits still, and any food can sit there, can get a sluggish bowel. It's easy for moms to get constipated, which is one of the reasons you shouldn't go home from hospital until you've had a bowel action. And you probably will be asked this, so just prepare to be asked about your bowels. Again, ask for a stool softener, no straining, and if you are experiencing pain, down below, when you go to the loo, you need to consult with your doctor. There are some conditions, like hemorrhoids that have closed off or not a very good blood supply. You need to make sure that you see your doctor. Don't be shy. Up to 80% of women suffer from hemorrhoids post-birth. And many of the time, those hemorrhoids will go away a couple of weeks afterwards. It's simply from the pushing and the pressure. Pooing is fairly common when it comes to the pushing phase during birth. Most doctors, nurses, midwives have seen it all. It absolutely does not affect us in any way, and we would always preserve your privacy and dignity and make sure that it's just gently wiped away, almost a non-event. For you, if that is one of your fears, I would suggest that the day before, if you are having a booked induction or if you are going in for a Caesar, that you make sure that you have very light meal. I would just encourage the moms to know that a sign of early labor is in fact diarrhea, sometimes very loose stool, which is your body's way of preparing for the birth. So you very often will actually evacuate anything that's there, and you would have an empty bowel when it comes to the pushing phase. So it's not guaranteed that you will have a poo while you're pushing, but if it does happen, we will make certain that we are respectful and mindful of the fact that you are concerned about it. I think talk about it. Talk about it to your gynae or midwife or care provider so that they're aware, and minimize interruptions in the labor ward so you can keep it as private as possible. That would also help to just decrease your fears or any concerns that you may have about people interrupting or coming in and seeing you like that. And then take a lovely spray with you. Take a doula with you. She would help massively, and take all of those lotions and things that smell beautiful, and so that the room smells nice, because often there is that mixture of amniotic fluid and blood and sometimes poo and wee, and the room can be very stuffy. And if you are particularly shy, you could perhaps speak to your partner and see if they would perhaps, if they do notice that that's happened, not mention it, if everyone could just be discreet. These kind of conversations you could have. The best practice guidelines no longer recommends a routine enema in preparation for birth. It used to be that all women were given one, and certainly in the case of a woman who's very, very fearful of having a poo while she's pushing, she may want to discuss with her doctor, because there are still some doctors who would give an enema, but it's certainly not a standard practice or considered a standard practice any longer. Usually in hospital, in the morning when you come in, or perhaps you would be given a script to get one the day before. So if it's a set date for the birth, then it might be given beforehand, but otherwise when you come into hospital. Well, the good news is that in today's world, we have so many options for pain relief that fear, while very valid and absolutely one of the main concerns that moms have is how will they cope, it doesn't have to really exist, because every step of the way, from when you walk into the hospital to when you leave, everybody is aware that pain management is so crucial, and no one is going to let you suffer in childbirth if your preference is to have something for the pain. There are moms who prefer not to take medication, and there's a lot of ways that we can relieve pain without the use of opiates or medicines or epidural. So starting with aromatherapy, massage, breathing techniques, reflexology, hypnobirth techniques, those are all very powerful ways of helping to decrease pain. So for a mom who has a really big fear that she's not going to cope, I would recommend she look into those hypnobirth courses or antenatal courses that will give her some tools to enable her to cope with pain, should it be hard for her to manage. Most of the time, moms that go into the labor ward are 100% aware that the contractions are going to be felt, that they come every 5 minutes, or if they're in active phase, 3 to 5 minutes, or if they're in the early phase, every 10 to 20 minutes, it can vary. But the contractions really go. So it's important that the moms are aware that when they do have this contraction, it's only going to last 60 seconds, and in between, there's a chance for her to rest, have no pain at all, and just get her breathing even and prepare for the next one. So it's all about preparation, and it's about managing the pain when it's there. So if it helps a woman to have a doula, which I would highly recommend, then you've got somebody with you that can do all of those things. And we know that moms who are less fearful tend to have better, quicker births, better outcomes, because with less fear comes higher oxytocin levels, and it's the oxytocin levels that help to drive the labor forward and helps the contractions to be effective. So a mom who's scared of pain would probably have less oxytocin in a longer labor. So please take a doula with you. Talk to your doctor about pain options. One of the options that's very safe, mainly due to the fact that it's in and out the system so quickly, is the Entonox gas, which is a mixture of nitrous oxide and oxygen. It's available in most labor wards, and moms can help themselves, usually at the start of a contraction, take a very deep breath, and the Entonox will peak. So when the contraction peaks, it'll feel a little bit less intense. The Entonox is a very good starting if you would like something that doesn't have any long-term effects on you or the baby. The contraindications, or should I rather say effects of Entonox on some women, can be that they feel nauseous or a little bit high, and they may not like that feeling, so then Entonox is not for you. And then, of course, we have water, which is a wonderful pain relief option. So if your hospital that you're going to offers water births, you could ask them to fill the bath. When you step into the bath, you're weightless and your tissues stretch beautifully and you're relaxed. You can move into position. So the bath is a wonderful pain relief tool as well. You can only get into the bath, however, if you're a low-risk pregnancy and you haven't had any pethidine, opiates, or an epidural. So no drugs, then you can use the bath. A very powerful way to deal with pain in the labor ward is to make certain that your partner is feeling calm and that he is okay, because his or her stress can have a massive impact on your birth and your pain levels. We know that pain is greatly decreased when the mom feels relaxed, when she has little fear, and then the oxytocin levels would be really high and the birth would go so much better and much smoother than if she was fearful or in pain and not managing it. And there are a lot of things that your partner can do to help with pain relief in the labor ward. One of them is touch. Now, some people don't like touch, and when someone touches them, they move away. It's stressful for them to be touched. But if your love language, or if you feel comfortable being touched, it may be that your partner would be the perfect pain relief for you, because touch during labor can be very beneficial, and touch in the right way and the right places. When it comes to positioning yourself in the labor ward. You do not have to lie flat on your back. It is in fact contraindicated to lie flat on your back, legs up in stirrups, which they rarely use today, but it is not the best way necessarily to give birth, because then your perception of pain is so much more. You're not necessarily in control or in your comfort zone, and you may want to lie on your side. You might want to squat. Some of the labor wards have a lovely shoe, horse-like shaped piece of furniture which the mom can sit over, and that would help massively. And of course with birth we have relaxin, which helps to open up the pelvis more. So a mom who's comfortable squatting, perhaps her pain would be so much less. Or a mom who goes onto all fours because she's having a back labor with a posterior position, which up to 5% of moms can have, would be great for her to move position. So simple things like touch from a loving partner in a way that is helpful, that's fantastic, and you can establish that beforehand. Massage, certain pressure points that can be touched to help you to relax, also fabulous. And as we've already mentioned, water, aromatherapy, lovely smells, hypnotherapy course, breathing. Always make sure your breathing is even in and out. Don't hyperventilate. This is the worst thing you can do in the labor ward. If you're a very nervous person that's afraid that you won't cope with labor, go and do a hypnobirthing course, because it's nothing to be afraid of. It's really just ways of teaching your mind to think positively about birth and helping you to breathe in such a way that you don't, as I said, hyperventilate. So even in and out breaths. And you can practice that at home. If you go to your freezer and get an ice block and you sit down and put that ice block on your wrist and count to 8, slowly breathing in, slowly breathing out for 60 seconds, which is the average length of a contraction, you will notice that when you do this exercise for 60 seconds, which is the length of a contraction, the ice, you won't even know it's there if you're breathing effectively and focusing your mind on visualization techniques or hypnobirthing techniques. So it's really about getting your mind focused in such a way that you're not thinking, a contraction. You're rather thinking, I'm going to meet my baby soon. I'm so excited. And you think of that contraction positively and breathe into it and out instead of holding your breath. And you will cope beautifully. Pethidine is a synthetic narcotic used very widely in certain countries. It's an intramuscular injection that's given into the bum muscle or gluteus maximus muscle, and most of the time it's given during the active phase. So when the mom's contractions are closer together and the mother's really, really tired and asking for something to help her, the pethidine is offered. It is, however, not a very safe drug to use towards the end when you're close to delivering, as we know that it crosses the placenta to the baby, and the effects on the baby are quite definite. We see the babies born a little bit flat and quiet, and we often have to give them a Narcan injection to reverse the effects of the pethidine. So when it comes to giving pethidine, it's still a little bit controversial. For some moms who have a very long early phase of labor that are really struggling and would like something but not the epidural, then the pethidine may be offered along with Atarax to help relax her. The side effects of pethidine can also be nausea. Some moms feel high, a bit out of control, and don't like that feeling. Occasionally moms may vomit. And of course the effects that it crosses through the placenta to the baby need to be kept in mind. When it comes to having an epidural, usually the lights in the labor ward will need to be put on. That is in order for the anaesthetist to see what he's doing, and you will have extra observation. We would then be checking your blood pressure probably every 5 to 10 minutes, sometimes more often, because once you've had the epidural inserted, you'll be put flat on your back. So baby's on the main superior vena cava. It's very easy for your blood pressure to drop suddenly as a result of the medication, the position, and of course it's quite overwhelming to have all of this happening. When your blood pressure drops, we have put up an IV, so nobody will be given an epidural without an intravenous line up on their one arm, and you will have a urinary catheter inserted. Because you can't feel to go to the loo and you're bedridden, we would need to make sure that the bladder is empty. so that the baby's head can come down nicely and we don't run the risk of a ruptured bladder. The catheter is necessary. So do prepare yourself for, in the event of an epidural, 2 or 3 people in the room. The anaesthetist will need to numb your back, so a slight burning sensation. Be prepared to lie flat on your back and have a blood pressure cuff on your one arm and intravenous line on the other. The epidural has got wonderful benefits for those women who are fearful of birth and for those women who are having a very tough, long birth that really feel they would so like to have a natural birth and deliver this baby naturally, but they're struggling to cope. So you can ask for the epidural at any point. The only concern would be towards the end of your labor, very hard to sit still and to cooperate, and the anaesthetist really does need to get to the epidural space without jabbing you too many times. So sitting still is very difficult when you're in transition, that sort of 8, 9, 10 centimeter time when the contractions are a lot more closer together. So it would be more beneficial to ask the epidural a little bit earlier when you can cooperate and sit. When you've had the epidural, not only will the monitoring be more often, but your baby's heart rate will quite possibly be on continuous monitoring for the first half an hour to hour to make sure that there's no effects of you being on your back. One of the effects could be that the heart rate drops, and that could purely be positional, not necessarily that the baby's in distress, but it is a concern. So we do see with epidurals a slightly greater increase of seizures, forceps and vacuum, and where the forceps and vacuum delivery comes in, which is really an assisted birth. So the vacuum is a cup that's put onto the baby's head, and the doctor will then put up the pressure and would actually lean on the bed and pull to help guide the baby out. We see with those babies, the risk would be a sort of swelling on the head, a caput succedaneum. It's really just a superficial swelling that doesn't affect the baby's brain, but it does look a bit like a cone head, so it can be frightening to see. If you do need a vacuum, it's much better to allow them to do the vacuum than not if there's a high risk or if they're concerned about the baby. To prevent having a vacuum, it would be ideal not to have the epidural, because then you could move around into position to help push. I do have some positive news though. When you have an epidural and it comes to the pushing phase, so your doctor or midwife tells you you're about to deliver, you're fully dilated, let's get you ready, and they're opening a pack and there's a lot of activity, you can ask them to turn down the infusion so that the epidural is not quite as heavy as it was initially when they put it up. So instead of total numbing, you have a little bit of movement, and you can actually help lift your legs, or you can get that sensation when, because the uterus is this wonderful muscle, it starts as this little pear-shaped organ, and now it's a huge muscle housing your baby. When those contractions happen towards the end, all those oblique and longitudinal muscles are bunching at the top of the uterus and pushing down, almost like they call it the fundus. So when you've got that pushing down motion, you've got that automatic sensation to push, a little bit like being on the toilet and having a big poo. The same muscles, the pelvic floor area, the same sphincter. That is why it's so important to feel what you're doing so that you can push effectively. So when it comes to epidural, just to bear in mind a little bit more risk of intervention. So the epidural, depending on how much dose was given, usually a couple of hours post-birth, you won't have full feeling in your legs. I always ask my moms if they need to get up to make sure that there's 1 or 2 people with them, because you do run the risk of getting up, a gush of blood. The uterus often post-birth has got some blood behind. You've been lying flat often. When you get up, your blood pressure drops. So you run a massive risk of fainting. So the first time you get up, to make sure there's help, and when you've had an epidural and you're lying in the bed, just try and move your feet and your legs, because all your blood has been pooling, and you really want to decrease your risk of any clots. So for any moms, not just post-epidural, but post-birth and post-Caesar, as soon as they have the sensation in their legs, to start moving, they can get the blood flow going around the body. The special TED stockings, those that help prevent clots, they're usually given routinely throughout the world post-Caesar. That is a better practice. And if you don't get given them, you need to ask your doctor for your special DVT stockings, which stands for deep vein thrombosis. We don't want any woman post-birth to have clots or to have that to deal with on top of having a new baby. So do ask your doctor for the stockings, and make sure you get them before you leave the hospital. Post-natural birth, not so much a risk because we would assume you'll be up and walking. And if you're not up and walking within 4 to 6 hours, you need to find out why and ask someone to come and help you. Some of the things to look out for post-epidural would be a lot of women do get a bit shaky, and that's not just to do with the epidural, that's related to the birth. You've got this surge of endorphins, you've got oxytocin levels, prolactin, all of these things. These hormonal responses are quite overwhelming, and the body does sometimes react with this hormonal shift. And not just the hormonal shift, but you yourself have been through this most wonderful, life-changing moment. And so a little bit of shaking can be expected and is perfectly normal. Post-Caesar, we also see quite a lot of the moms in the recovery room shaking and chattering uncontrollably sometimes. And in that case, it's really just to be reassured that this is quite normal. The doctors have seen it many, many times before. They will probably put a warm towel, or probably not a towel, a large warm blanket over you, and they will reassure you and just let you know that it's okay, it will last a few minutes and it should go. Another fear that is so often coming up in my class is the mom is really scared to be naked in front of other people. And privacy is very important to her. She almost feels that it's undignified to take off her clothes and possibly make some noises and perhaps have a poo or maybe do things that her partner's never seen her do. When it comes to being in labor, obviously you do have to take your clothes off, but there are many things you can do to preserve your dignity. So if you are a very shy person or someone who is afraid of this, I would suggest when you go into the labor ward that you first of all put a sign up. This will give you some control, that you know people aren't going to just randomly walk in and ask, chicken or beef? Can we clean the floor? Because you do sometimes have cleaning staff and your catering staff coming in to take your order for lunch and dinner. So to prevent unnecessary people coming in, just draw up a sign, please no interruptions, or kindly as discussed with the matron or doctor, nobody is to come in other than my designated doctor or midwife. In the private hospitals, you can expect to have an on-duty midwife who is part of the staff at the hospital, and of course your gynae will be called when needed for the delivery, and often they are in and out. So there's usually only 2 people in the labor ward. If you have an epidural, there can be 4 people. Your gynae, the anaesthetist, the nurse who's assisting to set up the epidural, and the midwife. If you're having a home birth and you're someone who's really, really frightened of the whole aspect of going into hospital and being exposed and not being sure of who's coming in and out, you may be a suitable candidate for a home birth. And that is if your pregnancy is healthy and you have an experienced midwife with an experienced gynae for backup. Making a noise during labor is quite normal. Perhaps doesn't seem normal to you because you're possibly someone who doesn't like to make noises or is very, very quiet. When it comes to the labor ward, we as midwives have heard everything. So there are times when it might be low guttural sounds, other times it may be screaming, it could be that you're shouting. All of these things are quite normal. What isn't normal is if you are shouting out of control or your noises are because you are feeling stressed about the delivery or about to deliver. We would prefer you to keep that energy and to breathe, as I mentioned, evenly in and out, and to focus on someone or something so that you can stay calm, because we really don't want you to get out of control and have to be, especially if you're having a Caesar, instead of having the spinal, have to be given a general anesthetic. What happens when you become very, very stressed and anxious. If you are somebody who's worried about making noises, again, I think you need to know that it's a normal process of birth. We don't expect you, there are very few people who have silent births. It's very, very rare, actually. In all my years of doing midwifery, I think maybe one person was silent because they chose to be silent, but it is unusual. And those sounds can really help you to birth your baby. When the pushing phase is taking place, sometimes low sounds while you're pushing are actually very, very helpful. If you're shy about these noises putting your partner off, perhaps your partner may not wish to be in the labour ward. Oh, heavens forbid. There are some partners who don't wish to be there because it's not the wishes of the mom who's giving birth. So we have to respect whatever feels right for you in the labour ward. If you feel having your partner there will inhibit you to enjoy the birth or to make the noises or just be yourself, it may be better to have a doula, a birth companion who's there to assist, and your partner leave the room and come back in at those points, and that's perfectly okay. With regards to making noises during labour, the hormone oxytocin is the same hormone that surges during orgasm, and most women are not silent during orgasm. So when it comes to birth, oxytocin is the hormone that drives the birth, and it's that hormone that helps women to give birth beautifully and to decrease their labour time. So if you are making noises, it's a good thing. Don't need to be shy or inhibited. But if you are shy or inhibited, then just do all the things that I've mentioned earlier on in the talk. Being separated from your baby is a genuinely big fear for many, many moms. You've waited 9 months for this beautiful moment. You've anticipated, and your mind is so ready to have this baby and to keep it with you. When you're separated from your baby, it can be really, really hard because you miss your baby. You feel sad that it's not the beginning you hoped for. And for moms who are separated, it takes a great deal of time to get that confidence back and to know that it's still going to be okay. What can we do in those instances? Firstly, to prevent it, and secondly, if it does happen, to make it still special and to make sure you're a part of your baby's life in those first few days when you're separated. Check that your baby, when your baby's born, check that they allow you to keep your baby with you. So try and find a hospital that encourages rooming in. There should not be a separate nursery for your baby. Skin-to-skin contact is well documented and researched to have massive benefits for your baby and for yourself for long-term healthy outcomes. Babies who are born and kept close to their moms tend to be much calmer, breastfeed way better and more successfully long-term, and also the moms tend to feel better about their birth experience when the baby is kept close to them. To prevent your baby being separated, I would recommend that you first of all speak to your gynae and check what their policy is. A baby does not need to be weighed and measured within the first hour. It can be done the next day even. Most babies' birth weight is not even accurate. They usually still need to poo and wee, and they might have excess fluid from the IV therapy that you received if you had an epidural or Caesar. In those cases, your baby's weight will only be accurate when you leave, and they lose up to 7% in the first 3 to 4 days. So please don't worry about all these procedures that need to be done. Speak to your gynae and midwife and let them know that you really fear your baby being taken away. Could we do all those procedures later? And that's perfectly okay to ask that. When you go into the hospital, check if they're following a baby-friendly initiative. Many hospitals are today, and that really means that they support breastfeeding and they support babies rooming in and staying with their moms. Try and get yourself a baby wrap, one of these pouches, especially for newborns, that are safe to use, and find out how you can baby wear. It's also a wonderful way to keep your baby close. In the event of a seizure or an emergency, you may need to let your baby go to the nursery or ICU for a short while, possibly due to a complication or just because they're worried about something. In that case, give your partner permission to go with and ask him or her to take a digital camera and perhaps take some pictures. And that should be allowed to do that. Just check with, there's a policy at the hospital, and then you come straight back. And better still, if you have a doula, the doula can be the one to go and come back and feed back to you how your baby's doing. There is no reason for a baby in the ICU to be separated from its mother. As soon as you're well enough, if you've had a seizure, you can ask them to help you get into a wheelchair, and you make yourself, make your voice heard. You make yourself available to go over to the ICU, and you can wash your hands. That's the most important thing. And touch your baby. Touch is very powerful for healing. Your baby will feel that you're there. You will definitely feel so much better if there is a separation, if you're allowed access to the ICU. And then if they do have a policy in place that they prevent you from seeing your baby, let them know about the better practice and all the research that's been done that supports skin to skin. And especially for prem babies or sick babies, when they're on their mommy's chest, they tend to regulate their respiration better, they tend to breathe better, they heat up beautifully to your temperature, and they're able to maintain their temperature very well. So do let them know that you would like to do this, and be strong with your voice. Sometimes you have to speak up for your child. If for some reason you are unable to get to the ICU to be with your baby, or if you've had a general anesthetic and are not awake to be with your baby those first moments, your partner can take his or her shirt off and hold the baby close and do skin to skin, and the benefits are huge. So it's really just so important that you know that either one of you can do that and be there for your baby. It has so many benefits and advantages. Having to fight for your wishes to be respected in this year and this day and age is really a pity, but it does happen that sometimes you feel you're not being heard. And it can happen that you have a care provider who is not respecting your wishes or is not listening to your birth plan or what's important to you. If at any point when you're chatting to your gynecologist, obstetrician, or midwife about the kind of birth you'd like to have, and you feel they're dismissive or not listening or not supportive of your choices, it's time to look for another care provider. Your birth is a one-time opportunity. You do not get to redo your birth. Many people remarry. Many people have that opportunity, but birth is a once-off special moment that you need to do to the best of your ability, and it is crucial that your care provider is on the same page as you and supports all of those things that you've written in your birth plan and enables you to feel comfortable with the decisions you've made. Of course, if you need to deviate for an emergency, that is absolutely understandable, and no reasonable person would do otherwise. So in an emergency, your birth plan will probably be torn up because we need to save your baby's life and do what's best for you and the baby. But you've got to trust that the person who you've been seeing to help deliver your baby or to be there if you're having a cesarean section is a very skilled practitioner, and they've got your best interests at heart. If it doesn't feel that way, you need to move. When it comes to interventions, many of the moms have let me know that they feel the doctor wants to do a Caesar, and is it warranted? So this is a hard question to answer, because if you're not the professional who's looking after that mom, you cannot, in all fairness, make a decision. But what we do know is that big babies can be born naturally. So if alarm bells should perhaps start ringing, if you've been told you have to have a Caesar, this baby's big. There are babies who are perhaps very big, so maybe over the 4.2 kilos, and the doctor is very worried about the risk associated with that. And there certainly are some risks to delivering a very large baby, but we simply don't want to take the risk of doing unnecessary surgery if that mom is going to have a beautiful natural birth and recover far quicker than having a Caesar. So if you're told your baby's big, you need to just have a warning bell in your brain that says, gosh, but many people have delivered big babies. Maybe I will be okay, and perhaps we can wait till I'm in labor and assess. Because remember, the baby chooses its birth date. So when a baby's ready to be born, they secrete a substance from their lungs that travels through the amniotic fluid and alters the level of progesterone in the placenta and kick-starts the oxytocin. And the oxytocin is the hormone that drives the labor. So we would prefer that babies are born when they're ready and not taken out too soon, because we then know that if they're born when they're ready, they've got a better chance of being healthier. Their lungs are more developed, their brain's more developed, they're still growing in utero. So if they're safely tucked in utero and things are going well at your checkup, you should not be having a conversation around Caesar. So unnecessary intervention, one of the things that come up the most is the Caesar. The second thing is induction. So when you're being given a date to have your baby, just bear in mind that only 5% of babies are born on their due date. The rest can come 2 weeks earlier or 2 weeks after. Very few babies actually come on that date. So an intervention such as induction should not really be discussed if you're 7 days over. Most obstetricians, gynaes, and midwives would allow you to go over the days, providing the placenta is working well, the amniotic fluid is at adequate amounts, and the mom is coping. And when I say coping, within the parameters of her blood pressure stable, her health is good, and she's actually able to carry this baby for a bit longer without any risk. Your date is not always accurate. So if we routinely take babies out at 38 weeks, we could be taking them out 3 weeks early, sometimes more, and that can have a big impact on their long-term health, particularly their lungs and the development. I think induction should only be discussed, and when I say I think, I'm really speaking to you as a professional. Induction should only be considered when there's genuine health concerns, such as a mom who may have a pre-existing heart condition and is feeling very tired and may need to go onto medication, and really a mother whose blood pressure is very, very high, and we're worried about that getting higher and the impact that may have on the mom and baby. Also, moms who are carrying very heavily and are uncomfortable and feel they can't go on. Of course, it's a valid concern if a mother is exhausted and feels she can't go on, but I could just urge you to please try and go as close of your dates as possible, and don't be afraid if you go over a little, as long as you're being monitored closely and you're in good health. There isn't a single mom or dad that wouldn't hope to have a healthy baby. All of us would want to have a healthy baby, and there's not a single practitioner that I know of that would purposely allow you to have a baby that's going to have problems. They're always going to have your best interests at heart. When it comes to birth today, we have so many pre-tests, in fact maybe too many, but we're able to pick up the majority of serious conditions very early, particularly those that you've mentioned. So if a baby has an obvious problem on the scan, when I say problem, I mean if we can see that there's a heart situation where perhaps the heart isn't growing well or the baby's not growing well, then we are able to get the best team together to help you. So doing these scans, on the one hand, does open you up to anxiety, but on the other hand, it allows you to know how to best prepare if there is something that needs to be done, or an intervention or surgery. Today, we have so much modern technology that we are able to fix the majority of cases where there is surgery needed. Brain damage, what we can do to prevent babies being brain damaged is have good births, Make sure that you see a care provider who is caring towards you. Choose a hospital that has a baby-friendly initiative, that is well-staffed, preferably. Find a midwife who's experienced if you're choosing a midwife birth, and ask these questions. Because when you know the answers, you'll very often find out that it's extremely rare. And when you know it's extremely rare, it might help you feel a little bit better than you know that everyone's on your side to give the very best outcome. If you do need to have, during your delivery, a procedure, or should I say an assisted birth, where they're using a vacuum or a forceps, there may be some small effects, but usually the baby does recover very, very quickly. If you are expecting a prem baby, it can be very, very frightening. Under these circumstances, I would encourage you to find out who the best neonatologist is at your hospital, or to speak to your doctor about getting a team together that you know is experienced with premature babies. Because there are certain things to consider. If you're having a prem baby, they would need to spend some time in the ICU. Find out if there's an ICU that specializes in dealing with premature babies. If you've been told that your baby has a heart condition or a bowel condition that requires surgery, have a look for a surgeon who specializes in those conditions. And the chances of a good outcome are very, very high if you have that skilled person. When it comes to having a cesarean section that is not needed, you really do need to make sure that you arm yourself with knowledge. And I think the best way to do that is find a good antenatal class, someone who's experienced and well qualified to teach you what to look out for. You don't want to second guess your doctor. This is not a good thing. If you don't trust your doctor, I'd be very concerned. It's important that you trust your doctor. This is the person that you are really giving the opportunity to be involved in the most important part of your life, the most precious, precious part of your life. So if you're worried about having a Caesar that's not warranted, what can you do? Knowledge is definitely power in this case. If you are asked by your doctor, what is your birth preference, and you state it's natural birth, and your doctor statistics are 90% Caesar, the chances of you having a Caesar are 90%. The first thing you can do is have that conversation with your doctor. What are your stats? And what is this hospital? What are the hospital stats? That will give you some idea of where you're starting. Secondly, if your doctor starts speaking to you about, this is a very big baby, you're quite small, I think this is going to have to be a Caesar. Have a conversation around what would happen if we waited and I went into labor and I would still be open to the Caesar if needed, but I'd like the chance to try and labor. That way, your baby's chosen its birth date and you've got that surge of oxytocin and all those hormones, and it will be a much more, I guess, needed Caesar if you realize at some point it's changed and that's what needs to be done. So accept it if it has to be, because Caesars are life-changing for someone who may have an emergency. And really, without a Caesar, many babies wouldn't be here. So we don't want to give cesarean sections a bad name, but we do want to promote natural birth for a mom who's healthy and a baby who's lined up beautifully to be delivered. Then we should respect that wish. If you are told at any point that you need to book in for a Caesar next week, that should also be a warning sign to you, because a doctor who's very worried will not discuss, they will book you in right now. My experience with gynaes and obstetricians is, if they're worried, they're going to give you a date this morning to pack your bags, or don't even go home. If you're still having that conversation, then there's still a chance to delay a little bit. Vaginas are so important. They are incredible in that they are designed to give birth. In other words, the muscle can stretch for the baby's head to come through and then go back. Natural birth has been given a very, very bad name in that a lot of doctors are telling moms, if you have a natural birth, you're going to suffer from incontinence, have difficulty in your sex life, and I prefer to do a Caesar for that reason. If you take care of your health, make sure your weight is within the normal parameters. So in other words, what's healthy for you may be different for someone else, but the weight gain during pregnancy can be anything from 8 to 14 kilos. Some women a little bit more, some a bit less. But if you're eating healthy, exercising, doing your pelvic floor exercises. In fact, research has shown that the muscles behind the legs and your core muscles are really important. So if you're doing Pilates, yoga, anything that focuses on that area, that can only be beneficial to you. Women who are concerned about their sex life need to have these conversations with their partner about what it is they're fearful about. If it is simply that their body's different, partners learn to love you the way you are. And in actual fact, it can be better. Sex can be better after you've had a baby, in that you've been through this experience together. And it's such a life-changing experience that many couples have reported they feel closer. If that's not the case with you, then it could be a matter of that you're feeling very dry and you're not ready, then you can get a good lubricant. If you're emotionally not feeling ready, you can speak to so many wonderful counselors. You can ask your gynae just perhaps to take some blood and check if there's a hormone issue that someone's missing. If it's simply that you feel overwhelmed with the baby being on your breast and you feel like your body is really just taken over and so tired from the day-to-day demands of looking after a newborn, get in a babysitter, get help. If you can afford a nanny or au pair or caregiver that can come in the day, do that. Sometimes it's about taking time for yourself that enables you to be a better partner and for your partner to understand that it's nothing personal. Some moms feel great a few weeks post-birth and are quite comfortable having sex. Others wait for their 6-week checkup, which is advisable because you do want to see that the bruising's gone and the stitches have healed if you've had any. If you've had a Caesar, that the wound is healing and on track. And often at that 6-week checkup, your doctor will do an internal ultrasound. So they'll put a probe into the vagina, which most people aren't expecting, to just have a look that everything looks okay. So I guess the short answer is whenever you're ready. The long answer is some at a few weeks, some at 6 weeks. There's no set. I guess what I'm saying is there's no set time when you feel comfortable. Many of the moms are concerned that they're going to fall pregnant very quickly if they have sex, and they're just busy recovering from this birth. And some of them are actually afraid because they're not on any birth control pill or injection, and the breastfeeding is not always 100% safe. It is considered a fairly good birth control method for the first 6 months, but it is not 100% safe. We would still recommend those moms would use a condom, or if their partner's willing to use the pull-out method, which is not always easy. But I think when it comes to having sex and being frightened that you'll fall pregnant again, then at your 6-week checkup, your gynae or midwife will definitely discuss birth control options. And if you do go onto the pill, make certain it's a progesterone-only mini pill, because that would not impact your breast milk supply so much. There are certain hormonal variations that can have an impact on decreasing your milk supply.